Hi, my name is Manoj Krishna, and today I'm presenting an unusual case of a whiplash injury that occurred 7 years ago. The gentleman is 51 years old and a retired policeman, and one of the only clues we could find was the reduced disc height at the C45 level, as you can see on this X-ray. The MRI scan shows the signal from the disc is actually not too bad, though the disc height is reduced, and there's no pressure on the nerves, even though he has got arm pain. And so we were a bit stuck in terms of what was causing his symptoms. We treated Brian initially with some facet joint injections, where we injected the joints at the back of his neck. And this provided only short-term relief. And therefore, the next step was to actually explore to see if the C45 disc was causing his pain. And we then did cervical discography at C45 and C56. As you can see on this X-ray, we put a needle in the C45 disc and it reproduced the pain he normally gets. We therefore followed it up with a disc replacement at the C45 level, as can be seen on this X-ray. And to my great relief and Brian's, he did really well. The hospital stay was only 1 day. Here's Brian telling a story. Okay. Afternoon, Brian.
Good afternoon.
So you're 51.
Yes, I am.
Okay, and retired from the police.
I am, yes.
Okay, and so tell me a story about your neck problem and how it started.
Well, it started after a road traffic accident and a whiplash injury about 7 years ago. When I got after the initial injury, I continued to get pain in the neck, which restricted movement, restricted the things that I enjoyed doing, like cycling, swimming, and it basically brought that side of my life to an end.
Okay, and you managed with, what treatment did you have in those 6 years?
In those 6 years, it was basically physiotherapy, and that was about it.
Right, and painkillers? Took
painkillers, a lot of painkillers for a lot of years.
Yes.
Yeah.
Okay.
Not very good.
Not very good. And what about day-to-day activities? Like, was your sleep affected, for example?
Yes, the sleep was affected. I had to take tablets at night to sleep, and even with those, quite often I would be disturbed during the night, wake up 2 or 3, 4 times.
Okay. And you also had some arm symptoms.
Yeah, I had pain in the shoulder, which radiated down the right arm and sometimes into the fingers, and quite often the pins and needles feeling in the fingers.
And was the arm, you said it was weak as well?
It was weak, yes. Very much down on the strength of the left hand, and I'm right-handed, always been stronger in the right. So,
okay.
Yeah.
And you also had some headaches?
Yeah, the headaches, the pain used to come up the neck and into the head, and causing pain in the head as well. So
okay.
Had a full remit of symptoms.
Sure. And the litigation in this regard had settled by now?
Yes, all settled.
All settled a long time ago?
Yeah.
Okay, and then I think you'd been around the houses, you'd been and spoken to quite a few people about options.
Yes, I've had a couple of MRIs. Most of the surgeons that I've seen have said that it was inoperable and we just have to live with it.
And I think when you saw me as well, the MRI just showed a slight loss of disc height at C45.
Yes.
But so we progressed further, we did a discogram.
That's right.
We put a needle in the disc to check if it was painful, and we found it was.
Yeah.
And we operated about 7 weeks ago now.
That's right, yes.
And let's have a quick look at that scar. Yeah, there we are. So it's a C45 disc replacement.
That's right.
So talk me through, please, your surgery, your recovery, and how you are now.
Well, the surgery went very well. Obviously, I had the surgical pain immediately after the operation, but within a few days that had gone down quite.
How long was your stay in hospital?
The stay was just overnight.
Okay.
So I came in the morning and I was out by the afternoon of the next day.
Okay.
So, yeah, it was fine, absolutely fine.
All right. And then how quickly did you notice that your pain had changed?
very quickly. I would say the pain in the arm had just about gone after the operation. But obviously I did have the operation pain, which I had to take painkillers for, and after about 4 or 5 weeks that's really settled.
Okay.
No longer taking painkillers, and I've got a much better range of movement in the neck now.
Okay, let's have a look at that, see what you can do. So what about the pre-operative neck pain that you've had for 6 years? You still got that? Or?
I've still got a little bit of discomfort after the operation, but it's nowhere near the pain that I had prior to the operation.
And the arm pain's gone?
And the arm pain's gone, yeah.
What about the headache?
Headache's gone.
Sleep?
Sleep's much better.
Okay.
Without tablets.
Okay. Well, thank you very much. And you're only 7 weeks, so I think over the next few weeks it's going to get better still.
I think it will, yeah.
Okay, thank you.